Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Shelby Welsh, who is the System PCT Training Coordinator at NYU Langone Health, about the organization's Career Ladder program. So, hi, Shelby, how are you?
I'm good. Hello. Thank you for having me.
Of course, and thanks for being here. I'm excited to have this conversation with you today. As I talk to a lot of CNOs and other people about the nursing pipeline, career ladders have been coming up more and more recently.
Yes,
Um, so I,
definitely.
mhm. So I wanted to start off by asking you, how have career growth opportunities in nursing sort of changed over the last few years or even decades?
Yeah, I think career opportunities for nursing in general has changed quite a bit. I think especially in the inpatient setting, you had like a pretty solid career trajectory. You would kind of set off at the bedside and then go up to management or maybe education. And I think now there's a lot of advanced practice opportunities for nurses, and there are career ladders being implemented at most hospitals, I would say. For nursing support staff, though, I would say that there were a good amount of career ladders implemented several decades ago, specifically in long-term care facilities. But for inpatient hospitals, we haven't really seen them implemented that often. I think just specifically for our nursing support staff, they mainly worked in long-term care facilities, and in the last, I don't know, 5 to 10 years, there's been more opportunities for them to work in hospital settings. And so those opportunities for them to kind of grow their career hasn't really been made popular so far. So that was kind of the main reason why we wanted to even start this program and implement it.
hmm Absolutely, and that's the perfect segue to my next question, which is to tell me about the program. What was the inspiration and what are some of the goals?
Yeah, of course. So um, really the inspiration behind it was we had a really strong professional development program here for nurses, and that was already implemented before I even started at NYU. There was a whole career ladder program that had been here for a while. It was worked on and pretty solidified over the last decade, and saw a lot of great results. There were a lot of studies done around it, and everybody had great career progression, but we didn't have one for our nursing support staff. I think also post-pandemic, just in the United States in general, healthcare saw so much turnover, especially for nursing support staff. People were just feeling burned out. There weren't a lot of professional development opportunities for our nursing support staff. So because of that, we looked at our career ladder here for our nurses and said, well, why don't we do something similar for our nursing support staff? I also think that across all of our inpatient sites that we have, because we now have five because we just added Suffolk in, but before when we implemented this, we just had four inpatient sites. We had different roles for ancillary staff kind of spread all over. So everybody kind of had different titles, different scopes of practice. So I think we looked at the nursing career ladder and said, we can implement this at all of our sites, but why don't we also just kind of standardize everything, ensure that all of our nursing support staff have similar opportunities, similar titles, and kind of level the playing field and make sure that everybody can have similar opportunities here.
Mhm. Absolutely, and I heard there's sort of a like three-tier system, so how does that work?
Yes. Yeah, so we implemented a three-tier system. They kind of all build off of each other. So each role we wanted to build off of one another, add compensation, add skills and responsibilities. So the first role is called the nursing attendant. So a nursing attendant is your role that you're going to work on in kind of constant observation settings. So they really focus on patient safety. So if we need somebody to sit one-to-one or watch a patient who might be in danger of hurting themselves or just falls, anything like that, we'll have our nursing attendants there for patient safety reasons. They can do vital signs, ADLs, things like that. And then the next tier up kind of builds off of that role. They'll be working more on the units and doing kind of just more hands-on with the patient's direct care. They can also do glucometers. They are going to be more involved in ambulating the patients. Again, just a lot more hands-on training hands-on care with the patients. And then building more on top of that too is going to be the last role, which is the patient care technician role. So with that tier, they're going to be doing lab draws, they're going to be doing blood cultures, 12 lead EKGs. They just have a bit more responsibility. And then there's, of course, training that goes into that. We want to get them certified. And because of that increase in responsibility, of course, we want to increase their compensation and ask that they get certified as well.
Absolutely. And speaking of that compensation, I heard there was a $2,000 pay bump for the
Yes.
certified PCTs. So what kind of led to that decision?
So, I mean, becoming certified is difficult for anybody. I mean, it requires time, effort, education. You have to become recertified. It requires recompetency, and people work full time. They have lives, they have families. So I think just offering that, it shows an investment into people and the education and the opportunities that they are giving themselves. I do also think that we just wanted to reward our staff, and on top of that, certification, sorry, excuse me, certification shows that it gives people a sense of gratification and reward.
Mhm.
And it also helps with patient safety scores as well. So I think it's not just an investment into our workforce, but it also is an investment for the staff as well.
Mhm. Absolutely. And just out of curiosity, is there any kind of crossover between this program and then you mentioned there's like a nursing career ladder program as well? Or like, do those sort of work in tandem? Is there an opportunity for people to move to the nursing one if they would like to, if they, choose to become a nurse?
That's a great question. There isn't right now, but we have talked about that potentially being an option in the future because there are a lot of staff members who would want to go into nursing. A lot of our PCTs and NAs, they are in nursing school as well. So we have discussed, how we can kind of bridge the two together, but we don't have anything right now.
Absolutely. So then you mentioned the patient outcome scores. So what outcomes have you seen from the program so far?
Yeah, so we implemented the program. It's been a little over a year and a half now, but about 8 months in, we did a full assessment and did an article and everything. So actually, I'm going to have to look at my notes because I don't have them memorized. I really should at this point because it's like pounded into my head. But
Yeah.
um,
Hmm.
so before the program was implemented, I think one of the biggest achievements was our certification achievements. So before it was implemented, only 8% of our staff actually had PCT certifications. And then 8 months after we implemented it, 58% of our staff had
Wow.
PCT certifications. And obviously we have that $2,000 incentive. So we have to
Mhm.
note there that like financial incentive is involved. But
Mhm.
I do also think that it shows our staff wants to continue their own education. They do want to stay here. It is an investment into their career. So yes, they're getting $2,000, but we also went from 8% to 58%. So
Yeah.
I um, I think that it's important to note that they are also investing in their own continued growth and education, which is great. We did have a decrease in turnover as well. So we went from 14.5% to around 8% in the 8 months that we implemented the career ladder. Obviously, there are other things that affect turnover. We can't look at every single angle here, but I would like to think that the career ladder made a big impact on that as well, because we didn't have any other sort of um, career advancement or professional growth opportunities. A couple other things. We had a pretty great first-time pass rate for our national certification. I think the first-time pass rate for the national PCT exam is around 70 or 75%, and our staff passed for the first time at 95%. So again, I think it just
Wow.
shows that they are dedicated to their own education, their own professional growth, and we're just very proud of our staff overall.
Absolutely. So then how did you justify sort of the investment in the program to the C-suite? Because obviously offering $2,000 to everybody is kind of a chunk of change. So how
Yes.
did you make that argument?
So luckily, this opportunity was actually our CNO's baby almost. So
Hmm.
our chief nursing officer and the senior leadership at HR, they actually came up with this idea together.
Hmm.
So they kind of already had the buy-in from the C-suite, but I think the program was intentionally designed to be pretty fiscally responsible. I
Hmm.
also think that post-COVID turnover rates in general were getting higher, and with turnover, I mean, that's also an investment, right? Like you are
Hmm.
um, paying for orientation, onboarding, and then doing that over and over again. And I think that in terms of retention rates and how much they decreased, um,
Hmm.
the CNO and the rest of the senior leadership team were looking at that, and they realized that it would be worth the cost.
Absolutely, yeah. And I don't know the numbers for replacing like ancillary services, but like I know for nurses it's like 60 to $80,000 a nurse anytime there's
Yeah,
turnover. So
yeah,
that's for sure.
it's quite a bit. Yeah, and
Yeah.
I just think that I should actually probably do some numbers on that. I'm curious what it is for ancillary staff. I know for nurses it's crazy,
It's
and I
pretty
can
intense,
imagine
yeah.
that it's probably not as much, but pretty close for
Yeah,
ancillary staff. Yeah.
absolutely. So speaking of CNOs, my last question for you is, do you have any
Yep.
advice for other CNOs or health systems that want to try a similar approach?
Yeah, I would say to get as many stakeholders or just people involved as possible, um, get buy-in early, and then just utilize senior leadership, utilize HR, utilize educators. The nursing education team was the most pivotal part of all of this. I would also say building consensus with everybody. It was essential, and getting everybody on the same page was essential, especially if you are at an organization where you have multiple hospital sites,
Mhm.
um, and just ensuring that everybody has a plan set in place. So just having a great team of stakeholders would be number one. I think measuring outcomes early on is really beneficial because there were some outcomes that I think such as more about retention and recruiting. I think if we kind of looked at those numbers a little bit early on and then looked at them as we progressed over time, this would have been kind of just a better look at overall how things were affecting the like our patients versus
Mhm.
just retention as well. I think that would have been something really interesting to look at. Um, and I'm trying to think what else for CNOs. Yeah, I think if they already have a career ladder in place for nurses, just utilizing something similar if they do want to start a career ladder for nursing support staff, utilize the same type of model and just try to engage their support staff in professional career opportunities because I think that it will be really rewarding. And I do think that staff will respond to it.
Absolutely. Well, thank you so much, Shelby, for your time. I'm grateful to
Of
have had
course.
this opportunity to meet you and hear your insights. And thank you
Thank
so
you.
much. Yeah, thanks to our audience for listening. Thank you.